One of the most important questions I often hear is, if I start physical therapy, can I avoid spine surgery? The honest answer is yes. For many patients, physical therapy can be very effective. But it is also important to understand that physical therapy is not about avoiding surgery at all costs. It is about determining whether your body can recover without it. Most spine conditions don't require immediate spine surgery. In fact, the majority of patients with back or neck pain improve with time and conservative treatment. That is why physical therapy is often one of my first recommendations. The goal is not simply to reduce pain, it is to improve strength, restore mobility, decrease inflammation, improve posture and movement and patterns, and help you return to your normal activities very safely. A common misconception is that physical therapy is just a series of stretches. In reality, a well-designed therapy program is much more comprehensive. Your therapist evaluates how your body moves, identifies muscle imbalances, works to improve flexibility and stability, and teaches you strategies to reduce stress on your spine during everyday activities. For many patients, that may be enough. Research has shown that some patients with spinal stenosis who completed supervised physical therapy can achieve similar long-term improvements to patients who underwent decompression surgery. While some patients eventually chose surgery because their symptoms persisted, many improved significantly without an operation. The important takeaway is that given conservative treatment and honest effort usually doesn't eliminate surgery as an option later. The situation can be a little different for a herniated disc. If your disc is causing severe leg pain by compressing a nerve, surgery may provide faster relief. However, studies also show that many patients who begin with conservative treatment ultimately achieve similar long-term outcomes. In other words, surgery may help some people recover sooner, but many patients still reach the same destination without it. So how do I decide whether physical therapy is the right choice for me? That depends on several factors. I look at your symptoms, your physical examination, your imaging, and whether you're experiencing nerve-related problems such as progressive weakness, uncontrollable pain, sensory loss, or loss of function. If you're getting stronger, your pain is gradually improving, and you're becoming more active, that's often a sign that your current treatment plan is working for you. On the other hand, if you've completed an appropriate course of physical therapy, followed your doctor's recommendations, and you're still unable to function because of persistent pain, worsening weakness, or ongoing nerve compression, it may be time to discuss surgical options with your surgeon. One mistake patients make is assuming that physical therapy has failed only after a few visits. Healing takes time. Building strength, improving mobility, and calming irritated nerves rarely happens overnight. Consistency is often just as important as the exercises themselves. It is also important to understand that physical therapy isn't appropriate for every condition. Certain emergencies, such as progressive neurologic deficits or conditions causing significant nerve damage, may require surgery much sooner. That is why an accurate diagnosis is always the first step before beginning any treatment plan. The bottom line is this: physical therapy is one of the most valuable tools we have for treating spine conditions, and many patients improve enough to avoid surgery altogether. But the goal isn't to prove that surgery is good or bad. The goal is to choose the treatment option that gives you the safest path back to living your life with less pain, better function, and the best possible long-term outcome.